adults to in their 40s. We also see this in Hispanic females. That's not uncommon. We can see this in Caucasian females as well. But most common in African American females. What is the treatment of periapical segmental dysplasia? You do tooth vitality and all the teeth are vital. There are no caries. There's no periodontal disease. They just have periapical segmental dysplasia. How are you going to treat it? You're going to not treat that entity. You're going to follow the patient. Unfortunately, some of our colleagues make a mistake and start endo on this stuff. And of course, at $600 a tooth times 4 teeth, fairly expensive mistake. Let's see, one of you had a patient either last week or earlier this week, a clinic patient with this entity, and this represents erythema migrans. What are some older terms for that entity? Geographic tongue. What else? Migratory glossitis. We're going to use erythema migrans. And what's the treatment?
None.
Unless it's really causing spontaneous pain, we're going to explain the disorder to the patient and follow the patient. That's it. Saw a clinic patient today with this problem, just without even a history. What would you call this? All right, this patient that has aphthostomatitis, probably has minor aphthy, may have one or a couple of recurrences a year, and treatment is? Yeah, we can leave it alone if it's not really causing a lot of pain. We're going to treat this. It needs to be treated with topical steroids. That would be standard of care would be topical steroids. Of course, there's 100 different methods of treatment out there, but one that will hold up in a court of law is topical steroids. Now, in contrast, we have a patient that was recently treated dentally for tooth restoration. Fortunately, not that. And about 2.5 days after treatment, developed a sore palate. And she has come back in day 3, and this is what her hard palate looks like. So she has what?
Herpes.
Okay, she has secondary or recurrent intraoral herpes. And she has these multiple clusters of superficial ulcers. And then in the center, this little grouping has coalesced. Does she have nicotine stomatitis? Nah. We've got some little irritated minor salivary gland ducts, but not enough to really officially make that diagnosis. How are we going to treat This case of intraoral secondary herpes. Well, this really is of shorter duration than, let's say, herpes labialis. So, generally speaking, I palliate this and tell them, you know, that it will be healed in a couple of days. We can give them some Motrin for pain. Some people will use chlorhexidine because it's thought that chlorhexidine has some antiviral properties. So we could just put them on the normal PerioGard. They could gargle for 30 seconds and spit out twice a day. And that might give them some relief. But other than that, they're going to have to suck it up for a day, you know.
Dr. White,
Yes.
how would it look different if somebody had like a delayed reaction to the,
Anesthetic?
yeah,
That almost never happens.
right, never,
Well, you know, you never can say never, but the likelihood that this is a reaction to the anesthetic or the penetration of the needle is absolutely remote. You know, the penetration of the needle has activated the virus. So you will have to, if you see this in your practice, which you will, you just 99% of the time expect this to be herpes. And treat accordingly. A young adult female has this yellow submucosal mass, posterior floor of mouth, just off the midline. So submucosal, you can see the vascularity over this, so you know this is submucosal, subepithelial. It's yellow. So what do you think this represents? Okay.
Kidney stones.
I would expect many of you to say lipoma, submucosal, yellow, and you get partial credit because of this position. This most likely will be a lymphoepithelial cyst. Most of them occur in this location, behind the salivary gland duct opening, just off the midline, near the reflection of floor of mouth and ventral tongue. Invariably, this is going to be a lymphoepithelial cyst. A 16-year-old female and has, almost looks like she's taken a bubble bath and decided to go under and open her mouth. So she's got multiple bubble-like areas of the posterior or the lateral dorsal tongue. We're going to have to rule out the term, we can't use papillary hyperplasia anymore. Okay, that is going to be an unacceptable diagnostic term. Can't use it anymore, except for midline hard palate. Okay. Someone back here is given the diagnosis. Anyone up in the front? Now this is rare, but it's so unique looking that I would expect you to know what this represents. So again, a little breadth of knowledge. Okay, this is a lymphangioma. Superficial lymphangioma, more than likely congenital. And it's because of the uniqueness of its surface characteristics and location that we can make that diagnosis. So everything else has been pretty common, except this and cherubism. Coming out of dental papilla. And what's the hue? What's the color?
Gray, blue.
It's grayish, bluish, violet hue, purple hue. And so this most likely represents what? Peripheral giant cell granuloma. good short-term memory from about 30 minutes ago. That's good. That's good. Newborn. Female. Maxillary alveolar ridge. As we palpate this, it's firm, but not bony firm. And it appears that the underlying bone of the alveolar ridge is not involved. So this is soft tissue, maxillary alveolar ridge in a newborn infant female. This most likely represents congenital epulis of the newborn. Rare, but again, its clinical presentation is unique. And either vestibule, submucosal mass, you can see the vascularity over it, and then you can see the color. This most likely represents